Live, and we will just give it a few seconds to go over and make sure that there are no other hiccups there. And I'd like to welcome everybody back to Alabama Care. Today we have Dr. Maulik Trivedi, the co-founder of StationMD, and Mrs. Paige Bagby, the communications manager at StationMD. Today we're going to be talking about the company and technology behind StationMD and how they are serving the disability community and how we can get StationMD here in Alabama. At this point, I'd like to hand it over. Dr. Trivedi, if you would introduce yourself.
Hi, thank you. First of all, thank you for having me. I am Maulik Trivedi. I am one of the co-founders of StationMD. I am a physician by training, and my role in the organization currently is business development and to get the word out about our organization. And I'll let Paige introduce herself.
Yes, sir. Thank you
Hi.
for being with us.
Sure.
Yeah, thanks, Alex. Thanks for having us on today. So I'm Paige Bagby, the communication manager at StationMD, and as Alex said, we are both here in Alabama. So I lived in New York City for over a decade, working in healthcare. I moved to Alabama, where I'm originally from, when COVID hit, and moved over by Lakeshore in Birmingham and into a community where there are many individuals with intellectual and developmental disabilities who were my neighbors and quickly became my friends. In that time, I've seen a lot of the transportation issues that they face, and it's especially challenging when they have a medical episode. So as a result, me working with StationMD and living next to them, we started to collaborate. I've been introduced to Alex at Alabama Care, and here we are today to have this conversation.
We appreciate at Alabama Care and the audience for you guys giving us some time this afternoon. And I just want to point out that Paige and I are in Alabama, but Dr. Trivedi and StationMD are nationwide and serving a number of states, number of clients nationwide. Dr. Trivedi, if you could give us a little bit of history of StationMD and the reason behind this product and service.
Sure. I'd be happy to. So let's an understanding of who we are and what we do, and then I can talk a little bit about how we were founded. So StationMD, our mission at StationMD is to elevate the quality of medical care for individuals with IDD, intellectual and developmental disabilities. We want to bring the care that we think this population deserves and elevate it and make it better. We just happen to use telehealth and telemedicine to do that. We founded the organization about, I think it was 2017. And by training, I'm an emergency medicine physician. I've been practicing for over 20 years in the New York region. And my three other partners are also physicians. And really, the organization was born out of us seeing individuals coming to the ER or urgent care, really for issues that we felt they don't need to be in the ER for. And it was just really rough on them. Number two, we saw the trauma that family members were going through, or DSPs, direct support professionals, in just getting them to the emergency department or urgent care. And then once they were there, we really didn't know how to care for them in the best possible way. Didn't really understand or appreciate the nuances that a family member goes through, or what it takes, not just clinically, but also non-clinically. And most of you on this call probably already know that most doctors aren't super well versed in caring for this population. And this, by default, individuals don't get the care that they receive. I'm very comfortable saying that because I was one of those doctors, as were many of my colleagues. And so we thought, hey, is there a better way that we can deliver care to this population and not make it so difficult and challenging on their family? And that was really the birth of StationMD in roughly 2017. And as you mentioned, that was in New York area. Now we are in about 14 states. So.
Yeah. Why do you think that the emergency room is kind of the go-to for individuals and families in this community?
Sure. Well, part of it is it's just a larger, a challenging problem. That's a national problem of really caring for this population the way they deserve. You really need to be specially trained. So there aren't that many physicians who really understand those nuances and needs. Now, you may have a primary care physician that cares for the individual in general, that someone to address the need, but because of the challenges of this population, oftentimes by default, they go, well, I can't handle this. This needs to go to the ER. Or you may be part of a clinic system where there's not a physician available all the time. So by default, go to the ER. The emergency department is a safety net, but it also is kind of a place of last resort where people go. I've had individuals come to the ER simply for a medication refill because they can't reach their doctor. And that's not to say that there aren't great doctors out there, but doctors are busy in their office all day, and something may transpire in the middle of the night, and they may not get back to you immediately. Or if they do, they not necessarily may not feel comfortable handling it over the phone, and so again, you go to the ER. The challenge for this population about going to the ER, I'll say going to the ER for anyone isn't going to be a pleasant experience, but you can imagine if you have sensory issues, you're nonverbal. Obviously, if you're a family member, you can appreciate you have to drop everything and go to the ER, and maybe have to miss work. So um, there are a lot of reasons, but the main reasons are there just really isn't good care for this population otherwise, and it's the a place of last resort.
Yeah, and that makes sense. And that transportation page that you were talking about can be very hard in the community. And then when you get there, sometimes the emergency room, you're sitting there for a few hours before you're able to be seen. But that story of someone going to the ER because they can't get a script filled is outrageous to me. And we're
Yeah.
kind of hearing, you know, nobody wakes up thinking I want to do a disservice to those that I serve, but can be a little overwhelming. And you mentioned that some of the doctors just don't have the specialized training. Are you noticing that there's more training going into the medical field now to support the disability community?
Well, that's a great point. I'll say first and foremost, it's a real gap in medical education and training in medical schools. It's getting a little better, but really we're far from the where I think we need to be in terms of educating our new physicians on how to care for this population to understand them. One of the things that all of our physicians, just to give you an idea, all of our physicians, of course, board certified doctors and many years of experience and carefully vetted by us, but they all go through a specialized curriculum and training to understand the needs of this population. So that's clinical, where constipation in someone with cerebral palsy is very different than someone that doesn't have that disability. A urinary tract infection turns into urosepsis. So there's all clinical picture that we train our doctors to learn and understand, but also the non-clinical. Like I said, just understanding what a mother goes through caring for her child with a severe disability, and being sensitive to that. It's like for you as a physician that maybe doesn't understand, say, well, why don't you just run to the pharmacy and get this med, or why don't you just go in the urgent care? And well, that is a process, and it's difficult. So our physicians are obviously clinically trained to understand those aspects of this population, but also those non-clinical challenges that this group of individuals, has to endure. That being said, I do think that um, the value of being able to keep someone in their home setting if they have a disability is greater than someone like you or I. I mean, it's miserable to go to the doctor's office or ER, but when you hop in the car or take a cab and you're there and you're by yourself and you handle it, getting someone that maybe can't walk, or like I said, doesn't talk, or has sensory issues and they may need specialized transportation. You're also putting that support staff or family member, they're out of commission for 6 hours. And we could tell you story or story. Hopefully we'll have some time to give you some examples of how we can impact that and really reverse that. Something that would have taken hours in the ER, we handle and resolve in 20 minutes.
Yeah, and I think that's very important that you stress not just the clinical side of things, but also speaking with the families as a holistic approach.
Yeah.
And from speaking with a number of parents, they say, being able to be heard by the doctors or being heard by the professional is part of that process. It's not so clinical where they're just asking you questions and jotting stuff down on a paper, but being able to express their fears and their concerns for their loved ones goes a long way in the long-term success, physical well-being of that family member.
Yeah. Absolutely, and I will tell you, on more than one occasion where I've had consultations with the individual. So just to give you an idea, we could have an individual that I'm speaking to, their support staff, their family member, and someone else in another county or part of the state can patch them in. So we're all talking, and many times I've had the family member support staff say, "This is the most I've spoken to a physician ever." because it's one-on-one. I'm not distracted by, my entire emergency department, or if it's a doctor's office, all the other patients. I'm focused on the primary issue at hand, and that's that person. Um, but yeah, I mean, having the ability to understand and listen to the needs, and I'll face, there's a lot of issues that go into the care for this population, and no one knows the individual better than the family. You know, I've been educated by mothers many times, like, no, this is how he behaves when when he shakes his head, that means he has a toothache, or this is not him, he's not himself or herself. And we really listen, because this is an individual that has expressed themselves in other ways, and so the family knows, something wrong. They may not know exactly what's wrong, but they know something's wrong, and that is so critical. And another part of
Yeah.
it is you get to
Go ahead.
see them, in their own home environment. Once I get someone in the ER and they're sitting in the waiting room for 4 to 6 hours, and they're already, bouncing off the walls and agitated, as opposed to now I see them in their own room with their, whatever their personal belongings. It's a lot different, and obviously a lot more convenient. So
Yeah, going to the doctor, sometimes my blood pressure goes up, and
yeah,
I get a higher
absolutely.
reading there. It's like, I'm not usually this nervous.
Yeah,
But I really
yeah,
like
absolutely.
I have a family member. She's my aunt, and she has cerebral palsy. And you pointed
Mhm.
out earlier that constipation can look very different in a person with cerebral palsy.
Right.
And that there had been a few instances we didn't know what was going on, but my aunt was straining so hard that she was turning blue and passing out, to the
Yeah,
point that we had to call an ambulance, and she did have to go to the ER. We thought something major was going on with the heart, a lot of different scare there, and it came out to she was just constipated. And we got on some other Colace, some things like that,
yeah,
and we haven't had an issue since then. But for a professional and a doctor to be aware that constipation affects people differently that have CP is a huge advantage to the family, where you're
yeah,
not, this happened 3 times before we've actually
yeah.
found a solution. So to
Yeah, no,
to have
absolutely. Yeah, no, no, I'm sorry to interrupt. But I think that you make a very good point. And it's unfortunate that's not the norm. When you go to the doctor, you expect you assume the doctor knows everything about you and your disorder, but that's not the case. Now, not everyone knows everything, but I think there's a core base knowledge of that physicians should have when caring for this population. We do about 26,000 virtual encounters with individuals with disabilities. The odds are that we've seen it before, and that is very important to have that breadth of knowledge and understanding, because, as I said, these are not inconsequential. The constipation, if it wasn't addressed, would turn into bowel obstruction, and then you're hospitalized, and people have died from that. And that's one example. This population individuals with disabilities tend to have aspiration pneumonia. Um, but I think it also really helps to understand the challenges. I don't know. Paige has a story of an individual that we took care of, and a child that had an ear infection that we handled. I think Amanda was her name. I don't know, Paige, do you recall that? But I think that's a great example of how we resolved that issue. If you wanted to talk
Yeah,
about that.
Paige, tell us about that if you can.
Yeah, so we have a mom who has used StationMD for her son, Cooper, who's 11 years old. Her name is Amanda Barnes. She loves to tell her story because she really feels like it's helping other families. So Amanda lives in Missouri. Her son, Cooper, is 11. Developmentally, he is like a 9-month old, but he's 5'7" and 190 pounds. And she says he's getting stronger than her by the day. Cooper hates elevators. He has autism, he has sensory issues. And so, when to get him to the doctor's office for something is difficult. So, one day she had, she noticed him tugging on his ear, and their option is to, she has to try and step away from work to try and get an appointment. If she can get an appointment in time with the doctor in an adequate amount of time, she would take Cooper, but also she has another young child who she has to bring with her. getting Cooper into the elevator to get up to the third floor where the doctor is going to come with a struggle. And she talks about people staring, and it's just it becomes a whole scene. And instead, StationMD has partnered with the state of Missouri to be available to all the disability Medicaid waiver recipients. So through that program, Amanda was able to just phone up StationMD, or she launched it on the app on her iPad or her phone, and was directed to a virtual waiting room for a few minutes, and then she was patched through to Dr. Kelly, and Dr. Kelly was able to talk to her, find out his symptoms, talk her through how to give him a balance check, and then is like, it seems like an ear infection. So that was a 20-minute process. It didn't have to, they had a prescription waiting at the pharmacy in minutes. So this is, another instance is that Amanda Cooper requires medical grade diapers that are not available just at Walmart or Target. So she has to get a prescription for those from the doctor. Well, if it's a Friday afternoon and she realizes at that moment that he's about to run out, then she's out of options. So now she's able to just, on demand, launch the app, start talking to a StationMD doctor and get it resolved.
Yeah. And thanks for bringing that specialized medical supplies. I need to re-up that for my aunt as well. So I appreciate you bringing that up. But many times I hear that if you're going to the doctor, it's a half a day. You got to take off work for a half a day. And the stress that comes with that, bringing the entire family, all the things that you need during that process. Now, you mentioned if you need to speak with a doctor through StationMD, you can just log on. It's not like you have to make an appointment for next week at 4:00.
No, that's correct. And I think the critical part to emphasize is that it is a 24/7 service, and that is correct. We're on all the time, and you usually get a doctor on within minutes, and to resolve your issue. It's an app-based solution that you really simply looking like we're doing this. It's based off of a Zoom platform, and what it is access to a physician that understands your needs and understands the disability community, available 24 hours a day, 7 days a week within minutes, not just for these emergent issues, but if you have a question or you need a med refill, or as Paige described, not all calls need to be emergent. You need to get your refill on your medical grade diapers or your seizure meds. We're happy to do that. We operate really in a fashion that you have a doctor that you can turn to and address your needs whenever you need them, from the comfort and safety of your own home, with the goal of really improving the overall care. Many times I'll see an individual and I'll institute some treatment, or if they're constipated, say, hey, let's try some liquids, and then we'll call back in 2 hours. We'll call back in another 2 hours. So yeah, it is available all the time. It's available immediately, and it really does foster independence and kind of a peace of mind for family members, knowing that you can have someone that you can turn to that can answer those questions and address those needs. I really think it's a powerful solution, and I say this all the time. As a physician, I really think this should be the standard of care for individuals with disabilities, because of all the things we talked about, the challenges that they are enduring and families are enduring.
Yeah, I know that families. Go ahead. I'm sorry, Paige.
Oh, sorry, just to add to that. So the doctors, the StationMD doctors, they're not on call. They're not sitting having dinner with their families and then go off and take a call. They are on a shift. So you're going to get a doctor who has his or her full attention on the patient and whoever is on that call.
Yeah, no, I think that's important to mention. And the one thing I always say is that if there is any silver lining to the pandemic, it's that telehealth and the delivery of medicine via telehealth solutions has been widely acceptable and proven itself as a viable means of delivering care. You may have it through your own insurance. I argue that the value of telemedicine for this population is so much greater. I mean, it really is impactful. So, um, one thing that we have seen is, as I say, serving as a resource. But we are not there to take over the primary care physician. If you have a doctor that you like, you keep your doctor. We are not there to replace them. We're really there to help the individual, the family members, and augment and support that individual's care. Just as if it was virtual ER or virtual urgent care or virtual doctor's office with doctors who knew this population.
Now, what does the communication look like between StationMD and a primary doctor? So let's say that I have a primary care doctor that I've been with for a number of years, but something happens 10 o'clock at night and I need to call into StationMD for an ear infection, thing like that. How does that
Sure.
communication between StationMD and my primary care doctor go from there?
Great question. So, we get calls and we'll take that and handle that emergent issue, like you said, for example, at 10 o'clock at night. Every interaction that we have, we document, and we create a physician's note. And that note is essentially what we saw, our assessment, and then the plan. And oftentimes that plan may be, hey, you're fine right now, or I'm going to do this intervention or start you on these antibiotics, and then you'll need to see your doctor at a more convenient time, maybe the next day, or maybe not. I'll just put a note into that doctor. Then what we do is, when we onboard these individuals, meaning when we take you on as a potential client or patient, we find out who your primary care doctor is, and we send and forward that note to the primary care physician. We can old school fax it, or we can send it electronically. Excuse me. So that physician knows, hey, my patient was seen last night at 10 o'clock. Here's what that doctor's thought. And it really helps what we call care coordination, kind of, so
Yep.
they know. And it also really helps kind of let the primary care doc know, because what happens if we're not around? For example, that person maybe will go to the ER. The primary care doc doesn't even know. They get put on another medication, and then they come home, and now they're on two medications for maybe high blood pressure. I mean, it just really helps to coordinate care so everyone knows. Your left hand speaking to the right, and this is a big issue in individuals with disabilities. They may go to a neurologist and then a psychiatrist and then their primary care doc and their GI, and they don't all talk all the time. And so what ends up happening is what we call polypharmacy. Individuals are on 6 or 7 or 8 different medications, and maybe some of them they don't need to be. So anyway, that's a long-winded way of saying that we coordinate care with the primary care doc. We are not there to replace them, but we're there to really support their solution. And they, once they understand, like, hey, these guys know what they're talking about. They really understand the patient. I'm very busy in my office. I also have a family, and someone calling me at 10 o'clock at night. Your physician's not just waiting by the phone to answer your questions. We are. That's what we're there for. We're there to answer those questions.
Yeah, I imagine many doctors really enjoy what StationMD is able to provide there. And it sounds like it's really relieving a lot of stress from the emotional side, relieving a lot of stress on the individual, the family,
Yeah.
and also the system. It's a lot of stress on the system to have the emergency room filled for 24 hours a day with 50 people. It causes a lot of
Yeah.
stress on Medicaid, insurance, those types of things. So it makes sense. I mean, we're going toward that as a society, more telemedicine, Zoom meetings, those kinds of things. Um, I do want to acknowledge chat here really quick. Mallory Karen says another thing about speaking with doctors and professionals is being respected and believed is very important. She said is huge. And she says, I wish I could have this. Mallory, we're going to get to that a little bit later here. But I wanted to ask, if you were to pick somebody that would be perfect for StationMD, is there somebody that really sticks out in your mind, or a scenario and environment there?
Well, I'll give you my thoughts, and then Paige, if you have some thoughts. I really do believe that it is um, perfect for anyone who may potentially have a medical problem or an issue, and so that's a pretty broad net, right? It's kind of like, do we really need an emergency department in our city or town or place? Well, you never know when you're going to need it, right? You might need it once or twice a year, or maybe you need it all the time. But the person that again, so I'll say that in general, it's good to have. It's one of those things that you hope you never need, but to know that you have it, it can be really impactful. The second thing I'll say is that what we kind of touched on, if you have a child like that, maybe have very big sensory issues or a transportation issue, or if you really are in a remote portion of the state or somewhere where it's, it's a challenge to get to a doctor that needs you, those are the types of people that I think really benefit. Just to give you an idea, though, we do work with individuals in their own home. We work with individuals that are part of a group home, and we also work with individuals that are in what's called an ICF, which is kind of like a skilled nursing facility for individuals with disabilities. So I'll say it. I think this is perfect for anyone that is caring for someone with a disability in general, but especially those with some of those issues. I don't know, Paige, if you had any thoughts on who could benefit from it.
Yeah, I mean, reiterating that point, it's for any individual who has intellectual and developmental disabilities and the family or support professionals who support them. This is often a lifeline. It's not just a matter of convenience. It's can be life-saving. It certainly was during COVID. And, we have collected data on our success rate, and we know that 90% of the calls that our doctors receive, they're able to resolve the issue without the individual ever leaving home. Well, that's been not just a matter of convenience, but that is, for some of these individuals, it's it's significant cost savings for provider agencies. That's a significant cost savings that they are not having to, they're able to avoid spending millions of dollars on specialty transportation. Also, millions of dollars on staff overtime fees and things like that. Those resources are then able to be dedicated to programs that support the individuals. So there's a mega ripple effect across anyone who sort of is, touching the individual, not physically, but, in their lives. So.
Yeah. And I think the point you make, Paige, the point you make, to tie in what was said earlier, we're actually at 92% of the calls we get, we're able to keep that individual in their home setting. And so the impact of that is, obviously, you're not transporting someone, you're not going to the emergency room, they're not getting admitted as much, you're bringing the quality of care up. But all of that, the first and most important part of it is you're improving that individual's quality of life. So those 6 or 8 hours that would have been wasted, done in 20 minutes, and they can do what they want to do. Obviously, there's an impact on the family, but you know what? There's also an impact on is the financial. And so for this to work, there's a benefit to the individual, but there's a tremendous, as Paige said, amount of savings. ER visits are expensive. Hospitalizations are expensive. So that's why we are really excited about this solution, because it's not only good for the individual and has a positive impact on the family and the care, but there's also an impact on the savings because we're averting expense.
I love coming across businesses and ideas that it just makes sense all the way around. It's like, yeah, I get it.
Yeah.
This should be everywhere. Everybody should have access to it.
Now, speaking of, that's a great. Thank you.
Oh, go ahead. I'm sorry. Speaking of access, you mentioned that in other states, a lot of StationMD clients may be in a provider home or a nursing facility. How does the training go for someone if they're eligible for StationMD? Do you call them and train them on how to do this, or do you contact their provider and train the staff of the provider how to do that? What does the onboarding process look like for the community where StationMD is available?
Sure. So first, I'll say it's extremely easy to use. It's simply, the way it works is a number, a toll-free number that you call. And when you call and you're enrolled in the solution, you actually don't even need to be enrolled yet. We can do that at that process at that time. You call that number, and we have what's called a navigator that will stay on the phone with you until you connect with a doctor. And the way you connect with a doctor is really you press one button on an app on your phone or iPad or whatever device, and that's how you do it. Now, that being said, we do provide training. just to walk people through how the process works. And we work with provider agencies and their leadership. We work with DSPs, and we also work with family members. Basically to train them, say, hey, if this happens, here's the number you call, and really that's it. But as far as some complex, like really understanding how it works and what it's really, we've intentionally made it super simple to use. But
Yeah.
regarding those agencies that we partner with, that onboarding, what we need from them is they need to tell us who they want covered. We plug those people into our system, and then we tell the staff or the family, say, hey, something happens, call us. And that's really as easy as it is.
I love that it's just a phone call. Click,
Yeah,
call this number, kind of click on this link, and we'll be there within a few minutes. And you said in 20, sometimes all it takes is 20 minutes to not have to
yeah.
go to the emergency room. That's
Yeah,
huge.
no, it is a super convenient. Yeah, super convenient. And again, I guess there's another benefit of I guess this recent pandemic is like people are comfortable with doing video calls and video discussions, a lot more comfortable with this solution. But yeah, we made it really easy to use. Mhm.
My follow-up question, even for myself, is so we're going more toward Zooms, telemedicine, this type of stuff. But what about for things where I want my blood drawn?
Mhm.
I take
Sure,
cholesterol medication. That's something that I have to keep an eye on. What
right,
about things for blood pressure? How do I measure that? Um, what does that look
sure.
like for you guys and for the future of telemedicine?
No, these are great questions. So, we have the capacity. So, when we work with provider agencies or group homes, they oftentimes provide us with just some basic vital signs like pulse, temperature, blood pressure. Now, there's also gadgets out there that we employ that are automatic. You just slip it on someone's arm or finger and you get a reading, and that's really it. Now, um, if we feel the individual does need blood work and it's not an emergent issue, they need to get it right away, we help coordinate that so someone can come to their home and draw the blood. Um, I will say this that I don't look at this as a substitute. I look at this as superior care to what they're getting right now, rather than going to the ER. That being said, obviously there's a lot of things that we cannot handle. If someone needs stitches, well, we need to send them out. We can't do that virtually. Not yet, I'll say. There's a lot of crazy stuff out there that's coming with robotics and artificial intelligence. But regarding the blood draws, or if someone immediately needs some kind of diagnostic imaging, if you fall and hit your head and you're on a blood thinner, you really should have a CAT scan. But the nice thing is, we have physicians who understand. They're trained ER docs who know, hey, this is something that you need to address now and need to go. Or, hey, you don't need this blood test immediately right now today. You can do it as another point. Or let me connect you with this lab that will come to your home and do it. So again, it's a resource that we have that we are able to really guide the family or person on what needs to be done, when and where. And so they have someone they can talk to.
Yeah.
And
So
that's
this would
also when, in the situation where there is an emergency where the individual does need to go out, StationMD will coordinate with the local emergency departments to prepare for their arrival.
Yeah,
yeah.
that's
So
a great
and
point, and I can tell you that's a solution that we have kind of, if someone does need to go to the ER, I'll call the ER doctor to doctor and say, hey, I'm sending John. Try not to make him wait in the waiting room forever. They're going to decompensate, and he doesn't need the whole blood test and CAT scan. He just needs, this done. It really helps expedite the care if in the ER a lot of times, but it also really is the gold standard for a physician, for one doctor to call another and say, here's what's going on. For those people on this call that maybe have been to the ER or been there with someone that they don't know, what I encounter a lot is someone will come from a group home with a DSP who doesn't really know the individual, and they have a binder that looks like a phone book. No doctor ever reads that. I don't know where to find information there. And so by default, I'm like, I'm going to do a bunch of tests. Now, on the flip side, I call and say, hey, this is Dr. Trivedi. I'm sending John in for leg swelling. He just needs an ultrasound. Maybe don't make him wait. Get him right back there and get it done. I'm just looking for a clot or whatever that test is. And then they're also a lot more hesitant to send them back out because they know that this doctor, Station MD, will follow up on their care, as opposed to like, I don't know what's going to happen. I'm just going to admit this person. So, but yeah, that is a solution. I'm sorry, a service that whenever we send someone out, wherever it is, we always call that receiving facility.
Yeah, it's kind of like guiding an emergency, even if it is an emergency. Having
Right.
somebody familiar with my family, my disability, if I'm calling on behalf of myself. And then I love that you guys contact the ER room doctors. That's so
Yeah.
cool
Yeah.
to help out that process there and kind of set it up.
No,
So another,
it's really it's sorry. No, it's just really has made a difference because well, I'm sure anyone who's been to the ER knows it's rarely a short process. So anything we can do to speed it up and make it better, we're willing to do.
now we're primarily talking to the disability community here in Alabama, but people say if you live long enough, you're going to have a disability eventually. Do you guys also focus on the elderly?
So our primary focus right now is individuals with intellectual and developmental disabilities, and then there are people that are, age into that that have a disability. We are talking to some states and helping cover some of their elderly population with chronic conditions because a lot of the challenges are very similar. But right now, our focus is those individuals with intellectual and developmental disabilities as of today. That may change as states really see the impact of our solution and have us go into adjunct populations like those with chronic conditions or those that are homebound, things like that.
Oh man, you guys are going to explode over the next 5 to 10 years. You guys are going to let me know
Yeah,
when you guys go.
yeah, hoping we can make an impact. And you said it earlier. Anyone that understands this population or has a loved one or a family member, a friend with, no one says to me or Station MD like, "Oh, that's a dumb idea." It's just a matter of how can we operationalize it because it is a change in culture and how you think and how you address care. And frankly, to be honest, how do we pay for it? And again, the beauty is that there is a lot of savings to be had. So that's where you get the how do you cover it, make financial sense of it.
Now, a number of other communities across the U.S. Have found benefit with Station MD. If you could talk a little bit about who you currently serve, different states, and how many you serve, kind of give a grasp of how big Station MD is.
Sure. So, and Paige can correct me on this, but I think we're in about 13 states, covering something like 30,000 individuals, 24 hours a day, 7 days a week. We partner with states. We partner directly with individual provider agencies because they see the value in this, and we are starting to have some talks with some managed, managed care organizations, and then also, like I said, state DD services or Health and Human Services, whatever it's called, and also state Medicaid. But I don't know, Paige, did I miss something? I think that's kind of our footprint right now.
Yeah, close, about 35,000 individuals.
35.
13
And
states and how
what's about 35,000 individuals. And this is, over the past 2.5 years, that number has really changed. So Station MD initially started by serving about 1,300 individuals across 3 states. And then when people started to get more accustomed to using telehealth during the pandemic, states started requesting the service. Provider agencies started requesting the service. So Station MD has scaled to meet that demand. What we know is that there's somewhere in between, it depends on what source you read, there's anywhere between 8 million and 16 million individuals with IDD across the country. So there are certainly more individuals who could be served. The state of Alabama, where we are not yet serving individuals, is one of the targets where we hope to bring the service to these individuals here.
Yeah. And all right. So I want the service. I have a family member that could benefit from Station MD. Can I get the service just for my family member?
Well, that's a great question. And unfortunately, in Alabama, not yet. So without going into really boring rules about Medicaid, most individuals with disabilities have Medicaid. And if you have Medicaid, you cannot contract directly with a group like us and say, hey, let me pay you. And we can't accept that. Let's just put it that way. So what we have to do with our services, we have to partner with the state on some level, or we have to partner with a provider agency. So let's say, for example, your organization that provide your long-term service and supports, or provide your group home for you, they can pay us and contract with us to provide this service to the individuals, and many do. Not in Alabama yet, but in many states. So unfortunately, you can't say, "Hey, I want this. Let me just pay you and do it." Again, because of Medicaid rules, we can't accept that. You have to go through state Medicaid, or again, the provider agencies that's providing your care has to partner with us.
Okay. So that would be something like, so my aunt lives in a home that a provider owns, and that provider could pay for Station MD kind of out of pocket,
Correct.
knowing that by using Station MD, they will have savings in the future because they'll have less emergency room visits. They'll have better
Yes.
care for their individuals. Their individuals that they take care of will be happier, will have a more pleasant experience speaking with their doctors. And because they see the benefit of that, they don't have to wait for the state or anything or Medicaid to approve it.
Correct.
The provider can pay for it on their own.
Correct. That's exactly it. And I'll tell you a few things. One, and Alabama is no different. There is a crisis of caretakers, of direct support professionals. So anything that we can do to support them, we should be doing as a community. So we are there as a resource for them. Agencies have saved a lot of money on not sending people out paying for overtime and them going to ER. I work with one agency that before we started, it was a group home of 5 people. If one person went to the urgent care or ER, everyone got in the van and went, because they just didn't have the staffing. So they do see a return there. And the other thing I'll say is we have priced this very reasonably to provide this service. To give you a rough idea, for some agencies, we charge them $30 on a month per month. That's it, $1 a day to provide 24/7 physician coverage to that individual, along with all the other stuff we do. We provide notes, documentation, education, because we believe in the mission and we want to spread it to as many people as possible. If you're charging, $500 or 1,000, whatever, it's just not going to have its impact. So we've made it very reasonable with the hope of,
A, do-
expand.
a
Yeah.
dollar a day just has a ring to it. It makes sense. Like you
Yeah.
said, all
Yeah.
around it makes sense.
Yeah. Yeah.
And Paige, this question will kind of be directed to you a little bit, but let's say I'm not receiving service through a provider, but I am on Medicaid, or I'm a family member. How do I help get Station MD to be accepted here in the state of Alabama?
Yeah, so I think that's what we're trying to, have a discussion about how we get this service here. And I think the most, probably the best way, there are two avenues. So one, you could start by talking to your Medicaid case manager. Start talking to them about the service and, forward our video, let them know about it, and start talking to them about how you can request it from the state. If we can get the state to start, recognizing the need for it, then there may be a sense of urgency to dedicate funds to providing the service for individuals who they serve. Another avenue is to talk with, if you're connected, affiliated with a provider agency, start talking to your provider agency administrators. There's this service called StationMD. I know that they provide medical care to individuals with IDD at other agencies, provider agencies. So how can we get that so that we know that we have access to a physician 24/7 on demand? So I think those are probably the two best ways. And then the third way is start talking to the advocacy groups. There's the Lakeshore Foundation here in Birmingham. There's the ARC, various locations around the state. So any of those organizations that are working closely with individuals who have disabilities, creating that level of awareness is going to start driving that machine forward.
Yeah, start advocating, talking to I'm sorry, go ahead.
No. I was just going to reiterate. I mean, this is, kudos to you, because I think that what I see is advocacy and just awareness and getting the word out, not just about us and what we do, but about the needs of individuals with disabilities. it's a daily challenge. What I find is that a lot of people talk about health equity and providing equal to people from different communities and different populations, whether that be along socioeconomic lines or racial lines or whatever. And then I chime in and say, what about people with disabilities? They're like, oh, yeah. They're always an afterthought to a lot of the solutions and services that we provide, and that your listeners really need, but it's driven by advocacy and awareness. I mean, you have to talk to your legislators, talk to the people providing care, because if there's a crack to fall through, individuals with disabilities fall through it. They just don't get the attention and the service and solution you need. As I said, telehealth is really popular and people love it, but telehealth for people with disabilities, we're one of the only or very few organizations doing it. So access and awareness, like Paige is saying, thank you for having us on here, because I think this is one way we want to get to more people to know about what we're doing.
Yeah, and I think here in Alabama, it's 1 out of every 5 individuals are on disability. So we
Wow.
as a community and as a state definitely need something like this. And for anybody listening, that if you don't like to go to the doctor, you need to start talking with your case managers. You need to start talking with your DSPs. You need to start talking with your providers, and Medicaid all the way up to ADMH, and say, hey, it causes me a lot of stress. I don't always get the attention that I need. It's an unpleasant experience. I know you guys are paying way out of pocket for my emergency visit. StationMD is going to alleviate a lot of my pain and a lot of your pain. We need to start talking about this as a state. And I think our numbers speak for itself here in Alabama. Like I said, about 20% of Alabamians are on disability. Now, as we kind of come to a close here, we always like to, and you've both mentioned some examples. I like to ask, is there another success story that you'd like to highlight that kind of drives home what the benefit is for the individual?
Yeah, I mean, I'll tell you, I'll give you one that was very, just to give you an idea, and your listeners have probably experienced this, um, that will be impactful and was impactful, because otherwise it could have had really serious ramifications. And first one is an individual that was banging their head and having these outbursts, and they got sent to the emergency department several times. They, I believe, got put in a psychiatric ward for several days. And this happened again. Long story short, when we evaluated the individual, we talked and took close attention. And we say we, it wasn't me, it was one of our physicians. And we had time and we had their records and we knew the individual. We spoke to the mother and figured out this was a toothache. This gentleman was banging his head because he had a dental abscess. They couldn't find a dentist who would take him, so we called the dentist. We explained the situation, doctor to doctor, and said, look, he's not going to be disruptive. He'll handle it. Anyway, long story short, this was a dental abscess or cavity that was taken care of and handled by us. And prior to us, the individual was put in a psychiatric ward for 5 days or something like that. So you can see that's a huge impact. The second part, I'll say that an example is really not as exciting and really, frankly, boring. But like I said, those refills. We've had given individuals refills on their seizure meds because they can't reach anyone that would have resulted in a seizure. So those are two examples that come to mind. And again, there's countless examples of how we've impacted an individual, but you can see there's a real ramification of using us versus not using us, from the outcomes to the individual, how that individual receives care, and how they feel, and of course the financial impact is there too.
Yeah, I think that's going to be one of our TikTok clips, is the difference of 5 days in a psychiatry ward as opposed to going and fixing a tooth abscess. It's just an amazing difference in experience for everybody involved, the individual, the family, and the system there. So thank you.
Absolutely.
Now, as we always like to ask as well, are there any upcoming events that you recommend individuals and families should attend? Are there any trainings going on through StationMD? Any conferences you recommend people attend?
So there's a lot of advocacy conferences that we attend and that we speak at. The one that's coming up this weekend that we'll be at is the American Association of Dentistry and Medicine for Disabilities, and I totally butchered it, but it's AADMD. That's in Orlando, and that conference is in conjunction with, I believe, the 20th anniversary of Special Olympics. So we will be attending and presenting there. We often attend conferences that involve disability nurses. I just came back from one, what's called DDNA, Developmental Disability Nursing Association. There's always the ARC is a big advocate in many states and nationally. And those are like some of the I say organizations that are advocacy organizations. In Alabama specifically, I don't know of any specific ones that are coming up. But again, your best option is to reach out to the disability division of the state, and they may have some more information. But again, if people on this call or this that are listening now have are interested in having us come down and present at a conference, or we'll go and spread the word wherever it's needed.
Yeah, I think that would be awesome. And just a side note, so Medicaid in Alabama does not cover dental. It's a big pain
Yeah.
for our community.
It's a national problem. Just getting to a dentist that will take the individual is tough enough. And this population has a lot of oral health issues because of that. It's a clinical problem that people with disabilities have. And again, that's a perfect example of, just because you have a disability, you shouldn't be deprived of dental care. Just because you have a disability doesn't mean that, you can't get your med refilled or whatever it is. So, yeah.
And last question here. Is there anything that we haven't talked about that you think an individual or family member could benefit from hearing?
I'll let you go first, Paige, or if you have.
Yeah, well, I just, going back to what Mallory, the comment that she had about being heard. So, just having access to a group of doctors 24/7 on demand, anytime you need them, who are speaking the language of individuals with intellectual and developmental disabilities. That seems to be a pain point that we hear often, is that, just being heard, understood, listened to. Now there is a group of doctors who are available at all times who can do just that. So,
Yeah. Yeah, no, I would echo that sentiment. And the only thing I would say is that it's not something new that I haven't said, but it's worth repeating, is I really do believe that this should be the standard of care. It's not for everything, but for many, many things. It is a safety net. It is a resource. It is a game changer. It's for families and individuals. I'll end on a quick, on kind of a funny story. Is I make the analogy to Blockbuster Video. When's the last time you rented a video? So we don't do that anymore. We don't do that anymore because there's a different way, a cheaper way, a better way of doing things. And I really look at telehealth and telemedicine as a more convenient, better, not a substitute, but superior to the old way of doing things. And I believe that it really impacts the life of an individual with disability. And so that's our mission, and we're hoping that we get to Alabama soon.
Well, I think we're definitely going that route as a society. We're going to do more of the electronics, and I'm very grateful that StationMD and you are pushing that envelope there. So thank you on behalf of the Alabama Care community for making waves there. Now you mentioned that. So how many doctors does StationMD currently have on staff?
So we have roughly 40 physicians that rotate around and take the call. I mean, we have the capacity to cover a lot more individuals, but we have a core group of 40 doctors that cover this service 24 hours a day, 7 days a week. And the nice thing about telemedicine is if we get busy, we can just add another doc in to help kind of diffuse that surge, as opposed to in the real world, you have to call a doctor, have to come in, by the time they get to the hospital, it's like, okay, well, this is over, or whatnot. So yeah, but we have a core group of 40.
Now, as a family member, or maybe as a parent, hearing that there are 40 trained physicians in the disability community that are waiting to hear from me and that understand what my family member, my family is going through, is such a relief to know that I have that support. So
Yeah.
I think Alabamians, we need to get on this. We need to get StationMD in here in the state. Once again, I really appreciate you both taking some time this afternoon and telling us, educating us about all that StationMD does. So thank you.
thank you for having us, and thank you for being a voice for individuals. I think that's absolutely critical, and I would venture to guess, thank all your listeners, because this population needs other people to speak up for them, and they deserve to have great care. So thank you for what you do. Appreciate it.
I appreciate
Thank
that.
you, Alex.
Yep. And at
Thank you.
this page, we'll go ahead and close down. So what you guys can do is just exit out of your window and it will close you out. And we'll all kind of give our cameras a little bit of wave and see you guys next time.
Thanks so much. Take care.
Yes.
Thanks.